The mostly that time.
Okay, so we're starting with the ANS topic, right? First one is adrenergic agonist. So before we move into that, we must understand a little bit about nervous system. Okay, so what does nervous system consists of? What does it? What does it have? What is the functional unit?
Neurons.
Neurons, yes, right. So neurons are there, right? And there is tissue which supports neurons, which is called neuroglia, right? So neuroglia, right, which sticks the neurons together and supports it, right? So neurons, what do we have? We have a cell body, right? This is called the cell body, right? And the branches that come out of cell body are called dendrites, right? Then you have the long axon, right? Followed by axon terminals. Yes, right? So you have the cell body, dendrites coming out of it, the long axon, right? And finally the axon terminals, right? So when a neurotransmitter goes and binds to the dendrites or to the cell body, like suppose adrenaline and all, noradrenaline, okay, goes and binds to the receptor here, right? It's a receptor here. What happens? It starts a action potential. Yes, starts an action potential means your neuron gets excited. Action potential travels down the axon, and from here, what is released? A neurotransmitter, right? Neurotransmitter. This neurotransmitter then can go and bind to organs and can produce
Action.
action. Right? Understood how? Yes. Right. Okay. Now, so now nervous system, right? So we classify nervous system into two. What? Central nervous system and peripheral nervous system. In central nervous system, what do you have? You have the brain and spinal cord.
Spinal cord.
Spinal cord. These two, right? So these two make up the central nervous system. Now, nervous tissue that is present outside of your brain and spinal cord comes under peripheral nervous system. What is present outside brain and spinal cord? You have cranial nerves coming out of brain, right? Nerves, right? Similarly, you have spinal nerves coming out of spinal cord. These come under what? Peripheral nervous system. Okay, PNS, right? PNS. Now, PNS divided into two again: somatic nervous system and autonomic nervous system. Somatic nervous system controls your muscular movements. Okay, so I'm talking, I'm writing, I'm talking, right? I'm doing is what? Doing this consciously. It is under my control. Muscular movements are under my control. Yes. So I will try to okay, speak. Just you have noise. See, there is background noise, or if you're not talking to me, mute and do that. Right? Okay. Right. Okay. Right. Fine. Right. So walking, talking, right, writing, all this is controlled by what? Somatic nervous system, right? It is under conscious control, right? And then comes your autonomic nervous system. If a crush comes in front of you, your crush, right? Your heartbeat will increase, heart rate. Can you control it?
No.
No. Right. Now, if you see something sour, like pickle or something, you may start salivating. Can you control it? No, right? Okay, gastric acid secretion that is taking place inside of the stomach. Suppose you have ulcer. Can you ask your body to
कुछ
sleep?
समझ में नहीं आ रहा है इसका एक्सेस
नहीं आ रहा समझ में? 1 plus, right?
नहीं मैडम
Right. So, okay, right. So, stomach produces what? Acid, right? Can you ask it to stop producing acid? No, right? So, such things are controlled by what? Autonomic nervous system. Things that are not under your control. Heart rate, right? Then breathing rate, right? Or secretion of acid, salivation, all those things. Understood?
Yes, ma'am.
You're able to follow, na? Others?
Yes, ma'am.
Okay, right. Then autonomic nervous system is divided into two: sympathetic nervous system and parasympathetic nervous system, right? Now, what is sympathetic nervous system? Sympathetic nervous system gets activated when you are in a flight and fight state. What state? Fight.
Emergency.
Flight means you are in a dangerous emergency situation. Suppose a dog is chasing you. Okay, you'll be running in front, and dog is what? Running behind you. What will happen to your heart rate?
Increase.
Right, heart rate will increase, sure, right? Now, you're running, you need more oxygen, right? So, in your lungs, there will be bronchodilation or bronchoconstriction.
More oxygen.
You need, so bronchodilation or bronchoconstriction?
Constriction.
Bronchodilation, you have to breathe,
Breathe oxygen, it will enter.
Right, so what will happen? Broncho?
Dilation.
Sure, no? Right? Bronchodilation. Now, third thing, you want to see clearly, right? Because you have to what? Hide somewhere, no? Dog is chasing you, right? So you have to see everything clearly, right? So meiosis or mydriasis, pupil size will decrease or will it increase?
Increase.
Increase, yes. Mydriasis, no? Yes. Mydriasis, right? Now, you're running, right? Okay. Now, do you have time to go to washroom to urinate or defecate?
No.
No, right? So there will be urinary retention. What will happen? Urinary
Retention.
retention, right? Now, do we have time to defecate? No. There will be what? Constipation.
Constipation.
Understood? Constipation, right? Then, you're running, na? So you need energy, right? Because you're running, right? You need energy. What supplies energy? Glucose. What supplies energy? Glucose, no? Right?
Yes.
So its concentration in the blood will rise. Understood? So blood
Yes.
glucose will increase. Clear?
Yes.
Another thing, right? Okay. Then suppose you were running since 40 to 50 minutes. All your glucose stores are over, right? Next thing that the body will utilize for energy will be
Other non-nutrient.
once
Fat.
glucose is over, then you start
Fat.
breaking down fat. Yes.
Fat converted into glucose.
Yes. Fat is broken down, right? So
Lysis.
lipolysis. Now, you're running where blood should flow more to your heart, skeletal muscle, or see you have two options. Okay, heart and skeletal muscle, or to your skin and kidney. Where should blood flow more?
Heart.
Heart, na? Because your heart is pumping, na, beating, na, rapidly. Right, you're running, right? And you're for running, what do you use? Skeletal muscles, na?
Yes, ma'am.
Right? So more blood should flow there, na? To heart and skeletal muscle, right? So blood vessels that innervate heart and skeletal muscles, they will dilate. What will happen? They will dilate. So that more more blood can flow to that area. Understood? Which two organs? Heart and skeletal muscle, right? So there you see what?
Vasodilation.
Dilation. Okay. Blood arteries that supply blood to heart and skeletal muscles. So you have only 6 liters of blood in the body, right? So if blood flow increases to one area, it will decrease in the other areas. Yes, right? So blood flow to skin and your kidney will decrease.
Yes, ma'am.
Yes. So there it will be what?
Constriction.
Constriction. Clear?
Yes.
Okay. So these are the things that take place. Okay. When you are in a flight and fight situation, or when your sympathetic nervous system gets activated, what happens to your heart rate? Come on.
Increases.
Just think a dog is chasing you, right? So heart rate will increase. Bronchodilation or constriction?
Vasodilation.
Bronchodilation.
That's a bronchodilation.
Lungs, right? We're talking about lungs, right?
Lungs.
Trachea, bronchi. So bronchodilation. Okay. Eyes, what is the effect?
Mydriasis.
Mydriasis. Okay. Then
Urinary retention.
You have time to urinate and defecate, right? Urinary retention. Then constipation, right? You need energy. Blood glucose levels rise. Yes. Right. Then glucose is over. What is left? Lipids, right? Lipid will be broken down, right? Blood flow to heart and skeletal muscle increase, na?
Increase.
Yes. Right. So there is dilation of those arteries. Yes. Then blood flow to skin and kidney decrease, right? To compensate. So there is vasoconstriction of the arteries which go to skin and kidney. Clear?
Yes.
Yes.
Yes, right. So these are the actions. Now all we have to learn is receptors. Okay, that we'll do today. Right. Now, fight and flight. What about parasympathetic? Parasympathetic nervous system gets activated when you are in a rest and digest situation. You have eaten a large meal. Now you are resting. Okay, in that situation, there is no threat, nothing. Right? You're in a safe situation. So rest and digest. Okay, digest. Your heart rate will be
Decrease.
heart rate decreases. Bronchodilation or
Constriction.
constriction, right? What about eyes? Mydriasis or meiosis?
Meiosis.
Right? Meiosis. You have time, right, to go and urinate and defecate, right? So there will be urination,
Micturition.
micturition, right? Urination and
Increased motility.
okay, defecation, right? Urination, defecation, right? So these things take place when you are in what? Rest and digest. Okay, so heart rate decreases, there is bronchoconstriction, there is meiosis, right? Urination, defecation. What about your body secretions? What about salivation, lacrimation, gastric acid secretion? Will they increase or decrease?
Increase.
Increase, right? Because you have to digest food, na?
Yes.
So salivation, right? All sort of secretions are enhanced when there is parasympathetic stimulation. Okay, clear? This much.
Yes.
Salivation, gastric acid, secretion. Clear, na?
Yes, sir.
Good. Any doubt till here?
No.
Others?
No, ma'am.
Okay. Let's see. Right. Now, next is efferent and afferent neurons. Okay, there are two types of neurons. One that carry impulses from the periphery to the brain, right? Carry impulses from where to where? From the organ to the brain. Okay, to the brain. And then we have neurons that carry information from the brain to the organ. Okay, to the organ, right? Now, those that carry information from the brain to the organ are called efferent arteries. Sorry, efferent neurons. What are they called? Efferent. Okay, efferent. How to remember? They exit out of the CNS. Na? They come out, na? Exit out of the CNS. Coming out of the CNS. Na? So they are what? Efferent in nature. Right? Efferent. Carry impulses from where to where? From CNS to organs. Suppose your brain has the knowledge that your BP is low. Okay, it gets the information that BP is low. What will it do? It will ask the heart to beat faster, right? So information is coming from the brain to the heart, right? And heart will start beating faster. Understood? So that is what type of information is carried. This information by which efferent neurons, right? Now suppose you touch something hot. Right. You come to know it is hot. How? Your brain will tell you no, that you have touched something hot. Right. So what will happen? From the skin, the signal is traveling to your brain. No?
Yes.
Right. Signals. Right. That is carried by which neurons?
Afferent.
Afferent neurons. Understood? Clear or not?
Yes, ma'am.
Right. Now your efferent division. Efferent means information coming from brain to the organs. Right.
Yes.
Is divided into two: sympathetic and parasympathetic. So this is what efferent division of your autonomic nervous system. Understood? So here you will see what? Information coming from the brain to the organs. Now you're not controlling anything, right? Brain is doing everything. Autonomic, no? It is under autonomic control, right? So all the signals that are coming from the brain will what? Determine what is going to happen, right? Bronchodilation, bronchoconstriction, gastric acid secretion, increase in heart rate or decrease it, right? Whether to increase blood flow to heart or to kidney, right? We don't decide all these things, now. It is pre-programmed, right? Yes or no? Hello?
Yes, ma'am. Yes.
Was it complicated?
Yes, ma'am.
Yes. You're able to follow, no? Right. Okay. So sympathetic and parasympathetic. Sympathetic is fight and flight. Right. What is the effect on heart? Heart rate?
Increase.
What is the effect on lung?
Bronchodilation.
Bronchodilation. Okay. What is the effect on your urination defecation? Promote or
Retention. Urinary retention.
And constipation. Right.
And constipation.
So to which organs increase?
Heart and skeletal muscle.
Very good. Vasodilation.
Dilation.
Good. Vasodilation. Blood glucose level increase or decrease?
Increase.
Increases. Mydriasis or meiosis?
Mydriasis.
Mydriasis. Okay, good. Right. Fine. So that is sympathetic. Opposite is parasympathetic. Right. Then you have one more nervous system under autonomic, which is enteric nervous system. There you will see a lot of neurons nearby your gut area. Understood? Right. Gastrointestinal tract nearby that. Okay. So they control your mood, everything, right? We are not going to cover that in this class, right? So we are only concerned about two divisions, sympathetic and parasympathetic. Okay. Okay. Now, anatomy. Basic things. See, we are talking about what? Peripheral nervous system. No? We are talking about what? Peripheral nervous system, right? So we are talking about the nervous tissue which is present outside the CNS. Yes, outside the CNS. Now going to sympathetic first, right? Now this is your brain, right? From brain comes out what? Nerves. We call it cranial nerves, right? This is spinal cord. From here comes out spinal nerves, right? So your spinal cord is divided into different areas. This is called cervical region. Then comes your thoracic, then lumbar, then sacral, and finally coccygeal region, right? And from these regions comes out what? Different nerves, right? Spinal nerves. How many? From cervical region comes out 8 right? 8 from cervical region, from thoracic 12, lumbar 5, sacral 5, and coccygeal
One.
area 1, right? So total how many? 8 plus 12, 20 plus 5, 25 plus 5, 30 plus 1, 31. Okay, so not 31, 31 pair of spinal nerves come out, right? So out of this, see, from T1 all the way to L3, no? Right? So T1, T2, T3, all the way to T12, then L1, L2, and L3. They make up the sympathetic division. What? Sympathetic division. Peripheral nervous system, na? Spinal nerves. Which spinal nerves? Those that are coming from thoracic region and the first L3 up to L3. Okay. So the neurons that come from here, they make up what? The sympathetic nervous system. Clear?
Yes.
Yes. Okay. So I'll draw it clearly. Just a second. Now. Okay. So you have the brain, spinal cord. हाँ,
मैम थोड़ा नीचे ड्रॉ करो, उधर वो ये आता है,
नहीं दे रहा?
नीचे थोड़ा ड्रॉ.
हाँ, ठीक है. अब दिख रहा है?
हाँ हाँ.
Okay, so this is thoracic and this is lumbar. Okay, so this area, from this area comes out your sympathetic, right? Sympathetic, right? Now, if you see how do we draw neuron? It is like this, no? Neuron, right? But when you draw it, you draw the this thing, cell bodies inside the central nervous system. Then what comes out? Axon comes out, and then it is joined by another neuron. So we have two neurons in sympathetic, ANS. How many neurons? Two neurons. Okay, two neurons. When you have this cell, see, in the first case, can you see the cell body here? No, no? In the diagram, have they drawn cell body?
No, no.
No. Why? Because it is present inside CNS. It is present inside spinal cord, right? And if it is present inside spinal cord, it is part of what? Central nervous system, na? Talking about only autonomic nervous system. That's why we have not drawn what? The cell body. Clear? Right. Now, when you have the cell body in the periphery, na? In the peripheral nervous system, it is called ganglia. What is the term used?
Ganglia.
Ganglia. Right. Cell body in the peripheral nervous system is called what? Ganglia. Right. Ganglia. Right. So this is ganglia. Right. Now, the neuron that comes before ganglia is what? Preganglionic. Na?
Yes.
Yes. The neuron that comes after ganglia is called postganglionic.
Post-ganglionic.
Right. So we have two neurons. One is preganglionic neuron. Other one is postganglionic neuron. Clear? Yes, right. What does your preganglionic neuron release? Major neurotransmitter released by preganglionic neuron? Acetylcholine. Okay, acetylcholine. Now, acetylcholine acts on which receptors, children?
Alpha.
Muscarinic nicotinic receptor. Muscarinic.
Muscarinic and right, nicotinic. Right, muscarinic. You have 5 different M1, M2, M3,
M2, M3, M4. Yes.
and M5. Right, but the most important ones are M1, M2, and M3.
M3.
Okay, 3. Then nicotinic are again 2 types, na? N and N.
NM.
M, right? N and M. This N na, is what? Think of it as neurons. So in neurons, what do you find? Which receptors you find in the ganglia? Neurons N type. What type? N type, right? Now your acetylcholine comes and binds to which neurons? Sorry, receptor N type, right? Question can come. They will ask you which is the major ganglionic neurotransmitter. It is what?
Acetylcholine.
Right, acetylcholine. Which is the major ganglionic receptor? It is what?
Nicotinic.
N type, right? Nicotinic. In nicotinic, which subtype? N type. Clear?
Yes.
So acetylcholine goes and binds to NN receptor, activates the postganglionic neuron, right? In sympathetic nervous system, what is the major neurotransmitter released by postganglionic neuron? It is norepinephrine. What? Norepinephrine, right? So norepinephrine is the neurotransmitter released by what? Your postganglionic neuron. Clear? Sympathetic division we're talking about. Clear now?
Yes.
Right. Once this is released, it will go and act on what? Alpha beta receptors, norepinephrine. Yes?
Yes.
Yes. And they produce action. Clear?
Yes, ma'am.
What action? You know. On heart, what is the action? Heart rate? Increase. Right. What is the action on tracheobronchial tree? Broncho?
Dilation.
All those actions are produced when norepinephrine goes and binds to alpha beta receptors. Okay, and stimulates it. Clear now?
Yes.
Yes, right. So, okay. Now, this thing. Now suppose this is sympathetic. No? Now in sympathetic there is one exception, that is the neurons that innervate your adrenal medulla. So what is adrenal medulla? You have on top of kidney there is a gland, no? Adrenal gland,
Yes, yes.
right?
Yes, sir.
You take the cross section. When you take the cross
Cortex and medulla.
Cortex medulla, yes.
Cortex and
middle
medulla.
one is called medulla, middle portion
Medulla.
is called medulla, outer portion is called cortex.
Cortex.
Right?
Cortex.
That's right. So we are not going to discuss about cortex, medulla this time, right? So a neuron comes directly from the central nervous system and innervates the medulla this time, right? So there is no two neuron connection, only one neuron, right? The one that is coming from the CNS, right? Directly innervates medulla, right? And that releases what? Acetylcholine only, no? It's coming from the
Yes.
preganglionic, right? It is. So it will release what? Acetylcholine. Which receptor it goes and acts on? Same receptor, nicotinic receptor, right? So on adrenal medulla, which type of receptor you have? Same, NN
Yes.
type. Okay, NN type. When that happens, what does medulla release? It releases epinephrine and norepinephrine, both.
Norepinephrine.
Right. So major one is epinephrine. What is the other name of epinephrine?
Adrenaline and noradrenaline.
Adrenaline,
Same
noradrenaline.
thing, right? Adrenaline and noradrenaline. So that is the hormone produced by your adrenal
Adrenal medulla.
medulla, right? So adrenaline and noradrenaline, right? Okay, epinephrine and norepinephrine. This is released into where? From the adrenal medulla, blood. Where?
Blood.
Okay, something reaches blood, it will reach the whole body, no? Through blood.
Yes.
Yes. So wherever alpha beta receptors are present, they will go and bind and produce action, right?
Yes.
Understood this much? All of you?
Yes, ma'am.
Others? Yeah. Yeah, no, Jatan? Yes. Okay. Fatima?
Yes, ma'am.
Yes,
Right.
yes.
Didn't hear your voice today. Okay, right. So, which is the major ganglionic neurotransmitter? Come on.
NN. Nicotinic NN.
Neurotransmitter, child.
Acetylcholine.
Acetylcholine.
Acetylcholine, which is the ganglionic receptor.
NN.
Yes,
Nicotinic
NN, right? NN, right? Now, sympathetic nervous system also called thoracolumbar because the neurons are coming from which region? Thoracic and lumbar region.
Yes.
Yes, so it is also called what? Thoracolumbar region, right?
Lumbar.
Lumbar, which is a major neurotransmitter.
Acetylcholine.
Acetylcholine.
Now, acetylcholine is ganglionic. No? When we ask
Adrenaline.
sympathetic,
Adrenaline or adrenaline.
Norepinephrine.
not adrenaline.
No.
Adrenaline is not a word. It is not produced by your neurons, right? Even though it goes and acts on alpha beta receptors, it is not produced by neurons. It is, So this is what? Norepinephrine. What?
Norepinephrine.
Norepinephrine, right? So major neurotransmitter of sympathetic nervous system is norepinephrine. Clear?
Yes.
Yes, right. Then adrenal medulla directly gets preganglionic fibers, right, from the sympathetic nervous system, right? And when those are activated, what is released into the bloodstream? Adrenaline and noradrenaline, right? And they travel through the blood and activate the whole body. No?
Yes.
The sympathetic nervous system gets activated, you can feel the effect on your whole body from head to toe. Clear? Different organs, no? Clear, no?
Yes. Yes.
Okay, right, okay. So sympathetic nervous system controls what? Fight and flight, no?
Fight and
Yes.
flight.
Right, and rest and digest is?
Parasympathetic.
Parasympathetic.
Right, parasympathetic. Okay, now going to parasympathetic. Again, this is preganglionic neuron. This is your ganglia, right? Ganglia, this is postganglionic neuron, right? What does preganglionic neuron release? Same thing, acetylcholine, like sympathetic, right? It will go and bind to which receptor? NN receptor. It will activate the postganglionic neuron. What is released? Postganglionic.
Acetylcholine.
Okay, acetylcholine. Same. There it is norepinephrine, right? Here it is acetylcholine. Right, acetylcholine. Now, which neurons or which nerves make the parasympathetic division? Four cranial nerves. Cranial nerves. Which are they? Three. Cranial nerve 3, 7, 9, and 10. Okay, and few that come from sacral region. Okay, sacral region. So the name is cranio because cranial sacral division. Okay, cranial. Your parasympathetic division is also called what? Craniosacral.
Craniosacral.
Yes, right. The 10th nerve, cranial nerve is called vagus nerve. The name is what? Vagus nerve. And vagus nerve contributes 90% of parasympathetic preganglionic fibers. Okay, so 90% is contributed by what? Vagus nerve. That's why you might in textbooks see, na, they write instead of writing sympathetic or instead of writing parasympathetic response, they write vagomimetic response. Might have seen. Have you seen? Vagomimetic. Why do they use that term? It is because vagus nerve is the major uh, major contributor to parasympathetic division. Clear?
Yes,
Yes.
Okay. Right. Fine. So that is your parasympathetic. Okay. Now parasympathetic division, craniosacral outflow. What is a major neurotransmitter? Come on.
Acetylcholine.
Acetylcholine. Right. And digest, acetylcholine, craniosacral outflow. You have cranial nerves involved are 3,
3,
7,
7, 9, 10.
9, and 10. Right.
10.
90% contributed by which
Vagus
nerve?
nerve.
Vagus
Vagus
nerve.
Vagus
nerve.
nerve, right? Now, see, sympathetic division, when it gets activated, you can feel the response in the whole body, no? Because through blood, this neurotransmitter or the hormone, right? Adrenaline is a hormone, right? Noradrenaline, they reach the whole body. But do you see such a thing in parasympathetic? Answer is no. You don't see such a thing. No? So the effect is only limited to the areas which are innervated by postganglionic neurons. So wherever they reach, like if they reach heart, right, you will see the effect on heart, right? If they reach the urinary bladder, you see the effect on urinary bladder, not in the whole body. Clear?
Yes.
Okay, this much is clear, na?
Yes.
I'm going to
Yes.
say a thing, pay real good attention. Okay, I want full attention. See, most of the secretions are enhanced by which division? Like gastric acid secretion, lacrimation, salivation, sort of secretions.
Sympathetic.
Parasympathetic, right? Parasympathetic. And the
Yes.
major neurotransmitter is acetylcholine.
Acetylcholine, yes.
So what you have to remember is acetylcholine increases all sort of secretion.
Yes.
Okay, understood? Now, but when you want your body to sweat, sweating, perspiration, when you want your body to sweat, when you're resting and digesting, when you're running,
Running.
running, right? When dog is chasing you, at that time you want your body to produce sweat, no? Sweating,
Yes.
right? That is parasympathetic, no?
Yes.
Right, sympathetic, right? So to make up for this, what body has done is, see, most of the neurons, postganglionic neurons, na, that innervate different organs, they release norepinephrine, na? Yes.
Yes.
But in sympathetic division, those that innervate sweat glands, na? Which gland? Sweat gland. Okay, this is sweat gland. They release what? Acetylcholine. Understood? So acetylcholine is a minor neurotransmitter. Major one is norepinephrine. The minor one is what? Acetylcholine of sympathetic division. Understood?
Yes.
No. Yes. Yes or no?
Yes.
Yes, ma'am.
Good. Very good. Then, so tell me, if I give, if acetylcholine is being released, it will go and act on which receptors? Muscarinic, no?
Muscarinic.
Present on sweat gland, right? Okay. If there is full-fledged sympathetic activity and I want to block it, suppose I give what? Alpha beta blockers, na? That's what I give, na? Because majority of the action is produced by what? Norepinephrine, na?
Yes.
Right. Okay. So if I block alpha beta receptors, I will get rid of sympathetic activities. Yes. Except for sweating.
Sweating.
Why? I will not be able to control this, no? Because this is mediated through what? Muscarinic receptors. No? Muscarinic receptors, right? So if you are trying to abolish or if you block alpha beta receptors, you will block all the sympathetic activity except for sweating. Okay. So this is important when we go to beta blockers. Okay. So those who want to know, I will just tell you a line. If you don't understand, we will cover that in beta blockers, right? Beta blockers, they mask the symptoms of hypoglycemia, right? Like heart increase in heart rate, anxiety, everything except for sweating. Why? Beta blockers go and block which receptor? Beta receptors, na?
Yes.
Right? They will not be able to block muscarinic receptors. Yes? Right? So they block all sympathetic overactivity, right? That hypoglycemic symptoms, except for sweating. Okay, sweating. That's why we say those who are diabetic, na, they should take beta blockers with caution. Okay, if you have understood, it is okay. If you have not, then also it's okay. We'll cover that under beta blockers. Clear? Okay. This much is clear, na? Basic things are clear, na?
Yes, yes, ma'am.
Okay, right. Fine. Now we'll take up the receptors and its action. So action, you know, now we are going to learn the receptors. Okay, all right. Now, so which are the two receptors, sympathetic receptors, alpha and
Beta.
beta, right? You can't see, no? We're right there. Just a second. Okay. Below this, if I write, can you see, Sabrine?
Yes, ma'am.
Right. Above this, you can't, na? Okay, right. So alpha, beta, right? Two types, alpha 1 and alpha 2, right? Beta, how many? Beta 1
2, 3.
and
3.
Three.
beta 3, right? Beta 1, beta 2, and beta 3. Okay, so we'll take up beta 3 first. Okay, I'll tell you where it is present. Tell me what happens. Okay, so beta 3 is present in your adipose tissue. What will happen? Lipogenesis or lipolysis? Sympathetic.
Lipolysis.
Genesis.
Lipolysis.
Lysis breakdown, yeah, lipid breakdown, then convert into glucose.
Because glucose over, what will body break down? Lipid, no?
Yes.
Children. Fatma, you're busy today?
Yeah, I'm outside.
Thought. Otherwise, she is the one who makes lots of noise, no? In class, right? Yeah. So, beta 3, lipolysis, right? Lipolysis. Okay, adipose tissue. Which receptor? Beta 3. So, beta 3 mainly present only in adipose tissue, right? Adipose tissue. Next, beta 1, right? Where is it present? Two areas. One is heart, right?
Lungs.
Okay. Wait. Okay. Heart and kidney. Where?
Kidney.
Heart and kidney.
Heart and kidney. Two areas only. Okay. Heart and kidney, right? Tell me what happens in heart, Gafar.
Heart rate increases.
Increase.
Heart rate will increase, na? Sympathetic,
Yes.
na? Dog is chasing you, right? Heart
Yes.
rate increases, right? What force of contraction increases. Okay.
Increases.
Conduction velocity increases. Now, what is that?
Increases.
Explain. Right. Conduction velocity increases. Now, what is heart rate? You know, it was beating only 70 times. Now, it started to beat 100 times in a minute. That is heart rate. We know, no?
Yes.
Yes. We know, no? Right. Heart rate. Now, what is force of contraction? Force with which your heart contracts. That also
Force
increases.
of contraction also increases.
Okay. Force of contraction also increases. Conduction velocity also increases. Now, what is conduction velocity? See, your signal is in heart, signal is generated by SA node, no?
Yes.
Then it travels to AV node, no? Right?
Yes.
Then down to ventricle through bundle of his, right? Left and right bundle branches. Now, what is signal doing? Traveling. Yes? So, if it is traveling, it will have a speed, no? With which it travels. We call it conduction velocity. If that increases, speed is increasing. Understood? So it is traveling
Impulse.
from where to where? From SA node to AV node, then down to ventricles, bundle of
Impulse.
his. So the impulse is getting conducted, right? So there is a speed of conduction, right?
Speed,
That
yes.
speed increases. Clear?
Yes.
Okay.
Okay, so what is happening? Heart rate is increasing, force of contraction is increasing, and conduction velocity is also increasing. Right? Heart. Now, heart rate increases. What is the term used? Chronotropism.
Yes.
Positive chronotropism. Okay. In exams, they might not write heart rate. They may say positive chronotropic effect. Right? Understood. So we must know what it is. Right? Force of contraction. Digoxin is a inotropic agent. No?
Yes.
Right? What does it do? Increases force of contraction. Yes. So you have a difficulty and remembering or if you are getting confused between chronotropic and inotropic, how to remove that confusion. Think of digoxin. Digoxin increases force of contraction. It is a positive inotropic agent, right? So chronotropism will be what? Heart rate. Okay, heart rate. So force of contraction increases, positive inotropic agent. Heart rate increases, positive chronotropism. Okay,
Yeah.
and then conduction velocity, dromotropism. What is the term?
Dromotropism.
Clear?
Yes.
Okay. Next is your kidney. From kidney comes out renin. Okay, when beta 1 receptors in kidney are activated, we said no, two areas. Heart, beta 1, kidney, beta 1. Right, beta 1, two areas. Right. Kidney, beta 1 receptors activated. What comes out? Renin.
Renin.
Okay, renin. Right. Renin. What is the activity? We will learn on Monday. Okay. Not today. Right. Everything we can't learn today. No? Monday we'll take in detail. Right. Renin, angiotensin, aldosterone system is there, which gets activated. We'll talk about it on Monday, right? So just remember, when B1 receptors are activated in kidney, what happens? Renin secretion occurs.
Renin.
Okay, REM secretion. Now, tell me, if heart rate increases, force of contraction increases, what will happen to BP?
Increases.
BP increases. Yes, right. So, force of contraction is increasing. So, when B1 receptors in heart, on heart, when they are activated, your BP increase. Yes, right. Similarly, when renin is secreted by kidney, na, your BP increases. Okay, how we will see on Monday, right? BP increases, right? So, what is the takeaway? When beta 1 receptors are activated, what is the effect on BP?
Beta 1, double A, ma'am.
When beta 1 receptors are activated, what is the effect on BP?
Increases.
Increases.
Increases, right? So, if you give beta 1 blockers, what will happen?
Decrease.
Decrease.
BP will decrease. Yes, right. So beta 1 blockers, you have metoprolol, atenolol, esmolol, right, celiprolol, all those drugs, right? All, not all laws. I'm talking about selective beta 1 blockers, right? So when you block them, what is the major indication? What is their major use? They decrease.
Decrease the BP.
Rate and force of contraction of heart.
By doing that, they do that. They decrease renin release, right? Both they do. No? Right.
Yes.
By doing that, what are they doing? What is the final effect that you see? Decrease in
BP.
Understood?
Yes.
Yes.
Yes. Okay. Okay. So we have covered beta 3 and beta 1. Okay. Now you're not saturated now?
No.
No. Okay. So I'm taking two receptors together now. Alpha 1 and beta 2. Okay. Why? Because their action is almost opposite. Okay. Alpha 1 causes contraction, constriction, contraction. Okay. Constriction. Right. Beta 2 causes dilation. Okay. Now dilation. Right. Alpha 1 contraction, beta 2
Dilatation.
dilation, right? Dilation. So I will tell the area, you tell me which receptors are present. Lungs, what is the effect?
Lungs,
Lungs.
bronchodilation.
Bronchodilation. Right, dilation. So which receptor will be there?
Beta 2.
Beta 2.
Beta 2.
Understood? Beta
Yes.
2. Right. Now, blood vessels going to your heart and skeletal muscle, they dilate or contract?
Dilate.
Correct.
Dilate because more blood has to flow there, na? Skeletal muscle and heart. Right. So, which receptor? Dilate, na? So which receptor?
Dilation.
Alpha.
Beta 2.
Beta 2. Yes. Abdul, clear, na?
Yes.
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 Yes. Now, less amount should flow to skin and kidney, na?
Renal.
Right. So blood vessels there will contract or dilate.
Constrict.
Contract.
Contraction.
They will constrict. Right. Which receptor?
Alpha 1.
Yes. Alpha 1. Yes.
1.
Alpha 1. Now, uterus. Normal uterus contracts. Which receptor mainly present?
Alpha 1.
Alpha 1 contracts. No? Normal uterus. Now, pregnant uterus, you have more relaxes. Right. Relaxes because of which receptor?
Beta 2.
Beta 2.
Clear? Beta 2 receptor, right? So alpha 1 causes contraction of uterus, beta 2 causes relaxation of uterus. Yeah, yes, relaxation. Now what you have to understand here is when a lady gets pregnant, her beta 2 receptors on the uterus, the number increases. Understood? So body adjusts it, right? Clear now?
Yes.
Okay. Now, next one. Suppose you have urinary bladder, right? This is the wall, right, of urinary bladder. And these are spinsters, right? Spinsters. Okay. Now, you have to cause urinary retention or urination. Sympathetic.
Urinary retention.
Right. So, for that to happen, your walls should contract or relax?
Relax.
Relax, right? The wall has to relax.
Yes.
Wall
Relax.
has to.
Relax. Sphincter will be closed.
Spinsters will be closed. This should be spinsters should be closed, constricted, right? Constricted. Your walls should be
Open.
Dilated.
Dilated, relaxed, right? Which receptors on the walls?
What's
Alpha 1.
Beta 2.
Walls are relaxed, no, children?
Yes. Beta 2.
Beta 2, na? Relaxation, dilation, beta 2, na?
Yes.
Yes. Spinsters are constricted. Which receptor?
Alpha 1.
Alpha 1.
The brain, very good. Alpha 1, right? Alpha 1. Now, same thing with your GI motility. Okay, GI, always remember, whenever there is contraction and all, motility increases, right? Motility increases, defecation, right?
Yeah.
When you have less gut motility, then you are constipated, na? Yes. So, wall needs to be relaxed or contracted. GIT I'm talking about. Constipation you have to cause, no?
Yes.
Dilation, right? Which receptor?
Dilation
Beta
B2.
Beta 2.
Beta 2, right? Spinsters should be contracted, no? Otherwise, stool will come out. Yes, right?
Yes.
Which receptor?
Alpha.
Alpha 1.
Alpha 1, right? Alpha 1. So decreased gut motility, relaxation is caused by beta 2, right? Spinsters are contracted using alpha 1. On your intestine, you will see all different types of receptors, but the action is mainly mediated by beta 2 and alpha 1, right? Okay, urinary bladder, we said the wall is made up of detrusor muscle. Which muscle? Detrusor. Okay, that is relaxed with the help of which receptor? Beta
2.
Okay, spinsters are contracted with the help of
Alpha 1.
alpha 1. This much is clear?
Yes.
Yes, okay. Next, we'll take up the eye. Right. What happens in eye? Meiosis or midriasis?
Midriasis.
Yes.
Sympathetic midriasis.
Midriasis. no?
Yes.
Sympathetic. We are talking about sympathetic, no? Right? So here in the eye, you have a muscle called radial muscle. Radial, it is radially located. So radial muscle, right? When radial muscles contract, it results in midriasis. Understood? They contract, what happens? Midriasis. They are contracting, no? Resulting in midriasis. So which receptor?
Alpha 1.
Understood?
Yes.
Yes. So midriasis because of contraction of radial muscles. Which receptor is present? Alpha.
Alpha 1.
Alpha 1. Right. Alpha 1. Okay. Then now you can't guess. We'll learn two things. Okay. Right. First one. What happens to your blood glucose? Sympathetic division activated.
Increases.
Increase.
Right. Increases. Okay. Who increases? Liver. Okay. Liver. Which receptors are present? Beta 2.
Beta 2.
Okay, beta 2. So when beta 2 receptors on the liver are stimulated, activated, what happens? Glucose output from
Increases.
right? So liver will give out glucose. It will release glucose into the bloodstream, right? So which process helps liver do that? First one, liver stores excess glucose as glycogen.
Yes.
When you take a lot of carbs, what happens? What you need is
Stored in
converted,
form of
kept
glycogen.
as glucose, and your body will utilize that. Excess of glucose is converted to glycogen, right? Glycogen is broken down, right? What is it called?
Lysis.
Glycogen is broken down, so glycogenolysis, right? Now, if glycogen is broken down or glucose are over, your body will have to synthesize new glucose, na? And that is done by gluconeogenesis.
Glycine.
No, gluconeogenesis. Right? Glucose,
Gluconeogenesis.
glucose is synthesized from non-carbohydrate source like
Fats and proteins.
proteins. Like fats are broken down, right? Proteins are broken down to amino acids. They are utilized for synthesis of glucose, and that is called gluconeogenesis. Right? Gluconeogenesis, right? So that is how your liver produces what? The glucose that the body needs, right? Needs. Which receptors are activated on liver?
Beta 2.
Beta 2.
Beta 2.
Beta 2. Right. So beta 2 receptor activators can cause hyperglycemia, na? Can they?
Yes.
Now,
Yes.
if I block beta 2 receptor, your glucose levels will decrease also, no? Hypoglycemia. Can that happen? Okay, that can happen, right? So that's why this chart is very, very important, right? Now, next is penis. Okay, in males, when alpha 1 receptors are activated, it helps them ejaculate. Okay, it helps in what? Ejaculation, right? Ejaculation. Now, yesterday we talked about competitive antagonism, no? Remember?
Yes.
Yes.
Which drug we took as example? Alpha 1 receptor antagonist. Remember?
Yes.
Which one? Prazosin. Remember? Right. So what was it? What is it doing? Blocking alpha 1 receptor. Yes. Alpha 1, it is antihypertensive agent, right? Antihypertensive agent, right? Prazosin. Okay. So if a male takes prazosin, what is the problem?
Prostate.
Prevent ejaculation. Yes,
Yeah.
because alpha 1 stimulation is required, no, for ejaculation. Yes, to occur.
Yes.
If it is blocked, it will prevent ejaculation, no? Right? So prazosin like drugs can cause what as a side effect? Prevent ejaculation in males, right? So in males, they can have sexual dysfunction. Clear?
Yes.
Not in females. Clear, na? So
Yes.
why am I giving you examples? I'm giving you examples to make you understand the chart that you're studying now is very important. Okay. So if you are thorough with this chart, there are a lot of things that you can guess. Understood? Without, we don't have to buy hard things here, right? We have to understand the reason why. Yes, only then if they give you a case study, you will be able to what? Guess the options correctly.
Yes.
Clear? Most of the times the options are going to be what? Very close to each other. Means when you read the question, all four options will seem to be correct. Right? So if you have to arrive at a right answer, but you should have clarity. Right? Clear now?
Yes, ma'am.
Okay. So shall we revise what we studied? Let's see how much you know. Right? So which are the two receptors? Alpha, beta,
Beta.
right? How many? Alpha 1, alpha 2.
Two, beta
Okay,
1,
beta
beta
1,
2,
beta 2, beta, beta 3. Right. Where is beta 3 present?
Adipose tissue.
Adipose
Liver.
tissue.
Lipolysis. No, beta 3, not beta 2. Okay.
Adipose tissue.
Adipose
Lipolysis.
tissue. Okay. What happens there?
Lipolysis.
Lipolysis. Okay.
Breakdown
Beta
of
1.
lipid.
Beta 1.
Heart and kidney.
Kidney
Right.
and
And
heart.
kidney. Right. What happens on heart? Effect on heart?
Increases the heart rate.
Everything. Heart rate, force of
Heart
contraction,
rate, force of contraction.
Heart rate.
and conduction velocity. Right. Kidney, what's released?
Renin secretion.
Renin secretion. What is it? Total effect, final effect. Increase in
BP.
BP.
BP increases, right? Then we took alpha 1, beta 2, right? Okay. What happens in lungs?
Dilation.
Bronchodilation with beta 2.
Beta 2, right? Beta 2. What happens in liver?
Liver, increased sugar level.
Glucose levels
Hyperglycemia.
increases, right? Which receptor?
Beta 2.
Beta 2, right? Blood vessels going to your heart and skeletal muscle. Which receptor?
Beta 2.
Beta 2. Why? Vasodilation.
Vasodilation.
What about blood vessels that are going to kidney and your skin?
Vasoconstriction.
So constriction, alpha 1.
Which receptor?
Alpha 1.
Alpha 1.
Right, alpha 1. Pregnant uterus.
Beta 2.
Beta 2.
Beta 2.
Relaxation.
Should be what? Relax, right?
Relaxation.
Ejaculation in males.
Alpha
Beta
1.
2.
Alpha 1.
Alpha 1. Right? Alpha 1, right? Okay. Urinary bladder. Wall of the urinary bladder.
Dilation.
Dilation.
Receptor.
Yes.
Beta 2.
Beta 2.
Dilatation, beta 2. Sphincter
And
constriction, alpha 1.
Sphincter alpha
alpha
1.
1.
Okay, alpha 1, right? Clear, na? Got, na?
Yes.
Is it tough? No.
No.
Right? But what do you have to do? Thoroughly study and come, okay? Monday, right? Otherwise, it will be difficult to take the topic, right? Okay. Should I give you a break? Do you need a break? We'll take. Okay, 8:20, start at 8:25, right? Clear, na?
Okay.
Okay. Right. Next is neurohumoral transmission, right? Simple thing, let's see. Right. So how does your neuron release neurotransmitter, right? Norepinephrine. Okay. Right. So first, what does it take up for synthesis of norepinephrine? Tyrosine, right? Amino acid, tyrosine, right? So neurons take up what? Tyrosine. Tyrosine, it is converted to what? Dopa. What? Dopa, right? Dopa becomes dopamine. Okay. Then in neurons, what happens? Dopamine is taken up by synaptic vesicles, right? Now you have dopamine inside the vesicle. There it is converted to norepinephrine and stored. Clear? This much. What is taken up for the synthesis of norepinephrine?
Tyrosine.
Right? Tyrosine, right? Question that comes is, what is the precursor for norepinephrine synthesis? Which amino acid? Answer is tyrosine, right? Tyrosine. So tyrosine is taken up, it is converted to dopa. Dopa becomes dopamine, right? Dopamine moves into the synaptic vesicle. Inside the vesicle, it is converted to norepinephrine, right? Norepinephrine, it is stored, right? So in synaptic vesicles, what do you see? You see a lot of norepinephrine, right? Clear? Now, so what is this area? This area, when you draw the neuron, we have drawn this area, right? So this area is this. Understood? Neurons. Clear, na? Which area? This is neuron, no? We have drawn, no? Which area? This area. Clear?
Yes.
Okay. Right. Now, what happens when an action potential comes? Now, action potential comes, travels, reaches where? Down. Right here in this area. It reaches. What happens? There is calcium influx. What happens? Calcium influx. Right. Calcium concentration inside increases. Exocytosis of neurotransmitter. Which is the neurotransmitter? Norepinephrine. Clear? Right. So the stored norepinephrine, when is it released into the synaptic space? When action potential comes down, right? And that action potential causes calcium influx, right? So calcium's concentration inside the neurons increase, yes? And that that causes norepinephrine release. Okay, my question. If I give a calcium channel blocker, okay, which has enough CNS penetrability, means it can reach your neurons, right? Will it inhibit neurotransmitter release? Does it have the potential to inhibit neurotransmitter release? Calcium channel blockers. Answer is? See, here calcium concentration should increase now for your neuron to release neurotransmitter. Yes or no?
Yeah. So it will not release
Connections
the
you have to understand, right? Right. So calcium concentration should increase. If I go and block calcium channels, will calcium move inside?
No.
No.
No. So does calcium channel blockers have a potential to inhibit the release of neurotransmitters? Answer
Yes.
is they have.
Yes,
Right?
yes.
You may need it sometimes, right? We don't know. Okay, that's what I'm telling you. The connection you have to understand. Okay, why otherwise there's no need to learn this, na? Clear? आ गया ना समझ में?
Yes.
Yes, right. हाँ, ask. Abdul.
Calcium channel blocker peripherally it will act on, ma'am. This is
No,
central.
that's why I'm saying those that have potential to act on neurons, not all.
Okay.
Okay. If they have enough lipid solubility, na, they can cause this. Clear?
So can cause BBB? Calcium channel blockers.
No, your dihydropridines won't do that. Okay, but verapamil might do.
Okay.
Okay, right. So calcium receptors, right? Channels, right? Calcium channels. Calcium influx, what is released? Norepinephrine, right? This much is clear? Yes.
Yes.
Now, once norepinephrine comes out, what it can do? First thing, it can go and bind to different alpha beta receptors and produce action, right? Yes, right. Second thing, now norepinephrine should not remain there. Na? Its action should be terminated. Na? Otherwise, it will continue to stimulate alpha beta receptors. Na? Yes, right. How is it terminated? There is an enzyme present in the synapse called catechol O-methyl transferase, COMT. Okay, it's COMT, right? So what it does, it hydrolyzes or breaks down norepinephrine, right? And the metabolites are excreted through urine, right? So norepinephrine metabolized by which enzyme present in synaptic space? Catechol O-methyl transferase, COMT, right? Next thing, if there is extra, it is what? Taken up by the same neuron, reutilized, right? Norepinephrine, right? Which transporter? Norepinephrine transporter, right? What is the process called? Reuptake and reutilized. Understood? Through which transporter? NET, norepinephrine transporter. Okay, what is the process called? Reuptake. Okay, reuptake. Clear? Now, where is norepinephrine present now? Here, no? Outside the synaptic vesicle, no? Right? Here you have MAO, monoamine oxidase. Understood?
Yes.
Which can metabolize norepinephrine. That's why it is stored where? Inside the synaptic vesicles. Understood? To prevent its degradation by monoamine oxidase. Clear?
Yes.
Okay.
मैम लास्ट का थोड़ा सा फिर से समझाओ लास्ट का नहीं समझा
See, norepinephrine is present in the synaptic space, right?
Yes.
The neurons take it up.
Yeah.
Okay. So where is norepinephrine present now? In the neuron, but it is outside the synaptic vesicle. Na? बाहर है ना synaptic vesicle के.
हाँ.
Right. So norepinephrine, if it remains there, na, monoamine oxidase will come and degrade it. Understood? So there are two enzymes which can degrade norepinephrine. One is your catechol O-methyl transferase, which is present in the synapse, synaptic space, right? Space between two neurons or neuron and a organ is the synapse, na, this area.
Yes.
Right? Synapse or monoamine oxidase, which is present inside the neuron. Okay. If norepinephrine is not stored inside the vesicles, MAO will degrade it. Clear?
Yes.
Sabrine, clear? Niyas, Jatin?
Yes.
Clear na? Okay. Right. Those who enable the camera will be given preference because I can see their faces. You see my face, na? What's wrong if I see your face? Right? See, it gives me idea if you understand whether you understand or not. A confusion on your face tells me a lot, right? And when you nod and smile, it means you understood, right? So expressions speaks volumes, right? That's why it is. That's why I ask students to what? Enable the camera, right? Okay. Clear, na, children?
Yes, sir.
Yes, right. So fourth one, monoamine oxidase will metabolize norepinephrine. Okay, norepinephrine. Okay, now We talked about alpha 1 receptor. We talked about beta 1, beta 2, and beta 3. Did we talk about alpha 2?
No.
Why? I forgot, you also forgot. Yes. Okay. Right. So, where is alpha 2 receptor present? On the same neuron, which releases norepinephrine. Understood? On the same neuron. What is it? What is this space called? Synapse.
Synapse.
Right. So, this area is presynaptic, na?
Yes.
Should I draw? Just a second. Huh? See, if this is neuron followed by an organ, what is this area called? Synapse.
Synapse.
Right? Synapse. So this area is presynaptic. This is
Presynaptic.
postsynaptic.
Postsynaptic,
Right?
yes.
Postsynaptic. So if you have any neurons here in this area, it will be presynaptic neuron na, before synapse. Na? If you have a receptor on the organ, you will call it postsynaptic receptors. Yes.
Receptor.
Right. So you have this alpha 2 receptor where on the same neuron that releases norepinephrine. Clear?
Yes.
Okay. So that is alpha 2. So the other name of alpha 2 receptor is presynaptic neuron. What is the name?
Presynaptic neuron.
Okay, presynaptic neuron. Now what happens when your norepinephrine goes and binds to presynaptic neuron, this neuron? What is the information that the neuron is getting? There is enough there is enough norepinephrine present. Yes, that is information. You have released a lot. Now stop releasing. That is information that goes, right? So when alpha 2 receptors are activated, norepinephrine release stops from the neuron. Clear?
तब
How to
सिनेप्टिक फंक्शन स्टॉप होता है ना फिर
सिनेप्टिक फंक्शन ही स्टॉप होता है न्यूरॉन में से नॉरएपिनेफ्रिन का रिलीज स्टॉप होता है
हाँ रिलीज स्टॉप ओके
देखिए नॉरएपिनेफ्रिन रिलीज फ्रॉम न्यूरॉन is stopped when alpha 2 receptors are activated. So what you have to remember? Stimulated stops, blocks, norepinephrine release will be more. Okay, opposite it is. It is important. I'll tell you why. Okay, understood this much?
हाँ
You want to know? I'll give you the example. Suppose whenever norepinephrine concentration increases, na, your BP increases. Understand that first. Okay. How and all you will learn. Okay. Norepinephrine concentration increases. What happens? BP
BP
increases. Okay. BP increases. You know about methyl dopa, na?
Yes. Yes.
What is it? Antihypertensive, right? Used in hypertension, right?
Yes.
Is alpha 2 agonist. Understood? So norepinephrine concentration increases, BP increases, norepinephrine concentration decreases, BP decreases. Right? Methyl dopa is what? Alpha 2 agonist. So when it goes and stimulates alpha 2 receptor, that will inhibit norepinephrine release. Na? Yes?
Yes.
Norepinephrine goes down, BP goes
down
understood. So there are drugs clonidine, same thing, alpha 2 receptor agonist.
Agonist.
So they both do, what do? They go and cause agonism of alpha 2 receptor. What will neurons do? They stop releasing norepinephrine. If norepinephrine is not released, what will happen? BP will
BP will release.
decrease, na?
Hmm.
Right, this norepinephrine only goes and binds to beta 1, increases heart rate, causes kidney to release renin, na?
Yes.
Yes, understood. Why? So alpha 2 receptors stimulation, what happens to norepinephrine release?
decrease block
Decrease.
Inhibited, blocked. Right? Clear, na? Yes.
Yes.
Jatin, Fatima, Rahman, clear?
Yes, ma'am.
Nasruddin, clear, na? Right. Okay. Right. Now, we said this is important. Okay. Those who are writing pharmacist exam, right? They need the structure. Those who are writing technician, relax a bit. Okay, you don't need the structure, right? Okay, you have to learn the structure, right, children? So what is the precursor? We said tyrosine. Okay, learn the structure of tyrosine. The rest we can derive from there, right? So what is tyrosine? You have the benzene nucleus, phenyl ring. Here you have a hydroxyl group, right? Then you have ethane ring. See, this is CH2, CH, right? Here NH2, because it is amino acid, no? So it will have a carboxylic acid and a amino group. Yes, right. So amino acid, right? So amino group and a carboxylic group. This is your tyrosine. Okay, easy. What? A phenol group. Think about a phenol group which is attached to a ethyl side chain, right? With amino group and a carboxyl group. Simple. Yes. Now what happens? Let's learn. Right. Tyrosine hydroxylase means hydroxyl group is added. Na? Hydroxylase. Na?
Yes.
Hydroxyl,
Yes.
you are adding what? Hydroxyl group. Right. So a hydroxyl group is added. Yes. Here you get what? Dopa. Okay. Dopa. Right. Dopa. Now this ring is called catechol.
Yes.
Catechol. Okay. Catechol. Now you will have catechol in all the structures now. Clear? So tyrosine is converted to a catechol, right? Okay, by adding a hydroxyl group. Clear now? Okay.
Yes, ma'am.
Next, this is dopa. Dopa undergoes decarboxylation, means minus CO2. No? Decarboxylation, carboxylic acid, sorry, carbon dioxide removed. No? Right?
Yes,
So
sir.
this is COOH is removed. You get what? CH2, CH2, NH2. There is no carboxylic acid group. What is this called? Dopamine. Clear?
Okay.
Yes.
Yes.
Okay, right. Nod your head, Nias, if you understood. If you sit like that, I will not understand. Clear?
Yes, ma'am.
Okay, right. Okay, you don't have to speak, just nod it if you understood, right? So I'll understand you understood. Yeah. Okay, now dopamine, right? Dopamine. Then uh, dopamine beta hydroxylase. Again, hydroxyl group is added. Where? This is nitro, this is alpha carbon, that is beta carbon. Okay, beta carbon.
Yes.
Here you had add what? Hydroxyl group. So dopamine, beta hydroxylase. Okay, hydroxyl group added, you get what? Noradrenaline.
Noradrenaline.
Okay, noradrenaline. Now, to noradrenaline, if you add here one CH3, na, right, you get adrenaline. Clear?
Okay.
Right, so what is added? You remove one hydrogen group and add a CH3, you get what? Adrenaline. Okay, which is the enzyme involved. Enzyme involved is important, right? So here you have phenyl ethanol amine N methyl transferase. It's not difficult. Phenyl, which is the phenyl ring? This ring, right?
Yes.
Phenyl, right? Ethanol, this is ethanol. No? CH3, CH2, OH. What is it?
Yes.
Ethanol, right? Ethanol amine. This is amine, right? Right. So phenyl,
Yes.
ethanol, amine, N-methyl transferase. And position, you're transferring a methyl group only na here. Understood?
Okay.
So what is the enzyme involved?
Yes.
Phenyl, ethanol, amine, N-methyl
Phenyl.
transferase. Okay. Converts your noradrenaline to adrenaline.
Adrenaline.
Clear?
Yes.
Yes, right. So this is the thing, right? We'll take it once again. Tyrosine, you add a hydroxyl group, you get what? Dopa,
Nope.
Yes.
right? You remove this carboxylic acid group, you get dopamine. Dopa
Dopamine.
decarboxylase, right? Dopamine, you add one hydroxyl group here, right? So dopamine beta hydroxylase. No? This is beta
Hydroxide.
hydroxylase, right? You get noradrenaline, right? Noradrenaline. Noradrenaline, you have to add a methyl group, no? To get adrenaline. Yes. So what is the enzyme involved? Phenyl,
Phenyl
ethanol,
ethanol amine
amine, and methyl
methyl transferase.
transferase, right? And methyl transferase. Clear?
Yes.
Right. Now, if you look at the structures, now all have this catechol ring, right? Dopamine has this catechol ring, right? Noradrenaline has, adrenaline has. They also have this amino group, right? That's why these three are also called by the name catechol amines. Catechol amines. They have the catechol ring as well as they are a amine.
Amine group.
Amine group, right? They have it, right? So all are called catecholamines. So when you hear catecholamines, what are we talking about? Dopamine, noradrenaline, or
Adrenaline.
clear?
Yes.
Wait. Okay, right. So they are going to adrenergic agonist, right? We are not into drugs yet. We will start talking about drugs in detail when we on Monday, right? So learn the basics now. So then it will be easy. You will be guessing everything, right? We'll see, right? So types of adrenergic agonists, right? So you have direct acting drugs. What are direct acting drugs? Drugs that go and activate alpha beta receptors directly and produce action. What do? They go and activate receptors, alpha beta receptors, and produce action. Let's take an example, right? Beta 2 activation on lungs. What is the effect? Beta 2 activation?
Dilation.
Dilation, right? Broncho dilation, right? So you can give such a drug in asthma. No?
Yes.
Yes, because asthma, bronchoconstriction.
Salbutamol.
Yes.
That's what, right? So asthma, you give what? Beta 2 agonist. Yes,
Agonist.
is it? Salbutamol, terbutaline, salbutamol, formoterol, right? So what are they doing? They are directly going and stimulating beta 2 receptor, right?
Yes.
Right? They are what? Direct acting drugs, no?
Yes.
Understood. So they go and stimulate beta 2 receptor to produce action, right? Now you have indirect acting drugs. What are they? They don't go and stimulate alpha beta receptors. What do? They increase the concentration of norepinephrine in the synaptic space. What do? They increase the concentration of norepinephrine there. And this norepinephrine then goes and binds to alpha beta receptor and produces action.
Action.
That means they will send someone to do the job. They don't do the job directly. Understood? They send who? Norepinephrine to do their job. Understood? They are indirect acting. So what do? They increase the norepinephrine concentration in the synapse. How can that happen? Either increase the release or inhibit the reuptake.
Constrict.
Understood? If you increase the release of norepinephrine, this is your neuron. Norepinephrine stored, right? If you increase the release, norepinephrine's concentration will increase, na? Yes. Now, if norepinephrine is present in the synapse, it is.
मैडम इन्हीं को तो कैटलिस्ट कहते हैं ना, कैटलिस्ट ऐसे
कैटलिस्ट वो होते हैं जो एंजाइम्स की एक्टिविटी को बढ़ाते हैं.
ये नहीं है ना.
नहीं. Catalyst increase the activity of an enzyme, catalyst, right? हाँ वो अलग है, right? हाँ. So norepinephrine release is increased, right? Or its reuptake is inhibited, right? Reuptake is inhibited. So when reuptake is inhibited, what will happen? Concentration increase, na?
Yes.
More is present. So this more will go and stimulate alpha beta receptors to produce action. Yes.
Yes.
Clear? Clear, na? Children?
Yes.
Okay, right. That is what? Indirect acting. Indirect acting. They don't go and stimulate alpha beta. They increase the concentration of norepinephrine. Okay, norepinephrine, right? Okay, either by increasing the release or by inhibiting the
reuptake.
reuptake. Right, reuptake. Which are the drugs? Amphetamine,
CNS.
progeners, right? Amphetamine, desamphetamine. Okay, all these amphetamine, right? Then you have tyramine, cocaine, desipramine. Okay, all these drugs do this, right? Okay, indirectly they act, right? Now then we have mixed action, means they have both direct and indirect action. Understood? Direct plus indirect are called mixed, means they can go and stimulate alpha beta receptors directly. They can also increase norepinephrine concentration, right? So they do both. Mixed action, agonist. Clear? Two drugs only. Ephedrine and pseudoephedrine. Okay, pseudoephedrine. Question that has come. Pseudoephedrine, what is the use? Only use is nasal decongestant. Okay. Only use of pseudoephedrine is, it is used as nasal decongestant. Okay, so keep that in mind. Other uses not used anymore, right? Because we have other drugs. Okay, better drugs, right? Okay, so majority of our drugs are what? They are direct acting drugs. Clear? Okay, right. Okay, we'll take up a question and then we'll discuss that. Okay. Okay, what is the precursor of noradrenaline?
Tyrosine.
Okay, tyrosine. Which enzyme catalyzes the conversion of dopamine into norepinephrine? Don't jump into the answer. Read it carefully, look at the structure and then give me the answer. Which enzyme catalyzes the conversion of dopamine into norepinephrine?
Dopamine hydroxylase.
Right. So this is dopamine. There is no hydroxyl group here. No. In the next step, you can see a hydroxyl group. Right. Saying dopamine is getting converted to norepinephrine. So this has to be dopamine and this has to be what? Norepinephrine. Right. Norepinephrine. What is happening? Dopamine?
Hydroxyl group.
Hydroxyl group is being added. So answer is what? Dopamine is getting hydroxylated. Right. Dopamine hydroxylase. Good. Okay. Okay, stimulation of alpha-1 adrenergic receptors leads to what happens?
Alpha-1, na?
Alpha-1.
B.
Take your time.
Blood pressure.
Okay, somebody has given this answer, right?
Elevated blood pressure.
Yes. Okay, Lakshmi. Right. Others.
Constriction, decrease blood pressure.
Decrease करता है. Okay. Constriction, blood vessel constricts, BP decreases, children.
No, increase, ma'am.
Increase, na?
Yeah.
So bronchodilation is caused by which receptor?
Beta 2.
Beta 1.
Beta 2.
Beta 2.
Beta 1.
Beta 2. Beta 1 is
Beta 2.
present in heart, right? On heart,
Heart,
and that
yes.
causes not bradycardia, tachycardia. है ना?
Yes. Yes.
Beta 1 causes what? Not brady, but tachy. Right?
Tachycardia.
Okay. Alpha 1 receptors, what is the effect on blood vessel?
Constriction.
Okay, it causes vasoconstriction, right? Vasoconstricted BP
Increase.
increase, right? So alpha 1 receptor stimulation results in elevated
Baby.
blood pressure. Lakshmi, right? Okay. Clear na?
Yes.
Right. This is how they ask questions. Okay. They will give you the actions and ask you to guess the drug also. So later on, when we this slide we will take up on Monday. I'm just telling you how they ask questions. Okay. So for example, they will say the drug caused bronchodilation, right? Heart rate was increased, right? Blood flow to bronchodilation, blood flow to skeletal muscles and heart increased, blood flow increased. Which drug might have been given? Understood. So from the actions, you have to understand which receptor was activated, right? And then you will have to understand which drug have the potential to activate which receptors. Based on that, which drug is given. That's how you guess it. Understood. So we are not going into that today, right? What you have to do now is to learn the receptor side and its action thoroughly, really thoroughly. When you come on Monday, we will take up the drugs on Monday. Okay. Not over yet. Okay, class is not over. Clear, na? Yeah. Okay. Homework you understood, na? Before while you come on Monday, you have to go through all the receptors correctly and then the action that you should be thorough with. Only then you will be able to guess the actions of the drugs. Clear, na? Okay, right. Now, so norepinephrine. Understand this. Norepinephrine or noradrenaline concentration, if it increases in synapse, there are two things that happen. But first thing that we said, BP increases. Increases. Now, CNS stimulation. What happens? CNS is stimulated, right? So opposite is also true. No? Norepinephrine concentration decreases. What will happen? BP
Decrease.
decreases, right? Okay. CNS depression. Sedation followed by depression. Understood this much?
Yes.
Norepinephrine concentration increases, BP increases, CNS stimulation.
Increase.
CNS stimulation. Norepinephrine concentration decreases, BP decreases.
Decreases.
CNS
stimulus also decreases.
Okay, right. Now, we'll look at the mechanism. You have to tell me whether norepinephrine's concentration in the synapse you are talking, right? Increase or decrease, right? If norepinephrine synthesis is inhibited, what will happen to norepinephrine's concentration in the synaptic space? Final effect. Synthesis decreased. So,
BP decrease.
you don't have to tell me that. We'll go into that. Concentration of norepinephrine in synapse, increase or decrease?
Decrease.
This is not taking place. So what will be released? Nothing. Right? So norepinephrine's concentration decrease. If it decreases, you see what?
BP decreases.
CNS depressant.
CNS. CNS
The
depression.
stimulation also decreases.
No, CNS depression you will see, right? As well as decrease in BP, hypotension and sedation. Understood?
Yes.
Right. Alpha 2 agonism. Alpha 2 agonism. This receptor, presynaptic receptor. Agonist, norepinephrine concentration, release, opposite. Increase or decrease? Forgot. Alpha 2 stimulation.
Increase, ma'am.
Opposite I said, na? When I put right, norepinephrine will be cross, na? Blocked, right? So alpha 2 stimulation, norepinephrine concentration, decrease. Blocked, right? So norepinephrine not released, norepinephrine concentration decreases, BP?
Decrease.
BP decrease, right? That is methyl dopa, na?
Yes.
Methyl dopa, alpha 2 agonism, na? Yes, right. Okay, alpha 2 agonism. Now, antihypertensive agent used in pregnancy. Which other drugs are effective? Which other drugs are effective in pregnancy? Safe in pregnancy. Write it down. Labetalol, your beta blocker. Labetalol. Then you have hydralazine.
Yes.
Hydralazine. And finally, nifedipine. Among your calcium channel blockers, which one? Nifedipine. Right, nifedipine. So which are the 4 drugs given to a pregnant woman when she has hypertension? Can be given. Okay, safely. Methyl dopa.
Labetalol,
Labetalol,
hydralazine,
Hydralazine, nifedipine.
Nifedipine, right? In among this four, the preferred two are methyl dopa and labetalol. Okay, methyl dopa and labetalol are preferred ones. Okay, preferred ones. Now, if she has hypertensive emergency, then labetalol is given IV. It is a drug which can be given orally, right? But when there is hypertensive emergency, the same drug is given IV.
IV.
Clear? Right? IV. Yeah. Okay, that is your methyl dopa, right? Methyl dopa. Now, inhibition of vesicular uptake. Now, if this vesicular uptake, norepinephrine, see, you have this neuron, right? Norepinephrine taken up by reuptake reaches your neuron, then it has to move into vesicles, no? Right? Otherwise, it will be degraded by who will degrade it? Mao, right? Mao, right? So, if vesicular uptake is inhibited, what will happen to norepinephrine's concentration?
Decrease.
Decreased, right? If it is decreased, BP will
Decrease.
okay. Sedation or stimulation?
Decrease. Sedation.
Sedation. Depression, right? That's why reserpine does that. What? Inhibits the vesicular uptake. That's why it is an antihypertensive, na? Rhabolfia serpentina. Remember? Cognizant, right? Antihypertensive. What is the side effect of it? It causes depression. Understood why?
Yes.
Yes, right. Something that promotes the release of norepinephrine. What will it do? Increase, no? Concentration.
Yes.
Yes, it will cause CNS stimulation. Yes.
Yes.
Amphetamine is a CNS stimulant, no?
Yes.
Yes, right. And it can increase your BP also.
Yes.
Right. Okay. Reuptake inhibited by blocking NET. Reuptake inhibited. Norepinephrine's concentration will
Decrease.
synaptic space.
Oh,
Inhibited, no? So synaptic space concentration increase, na?
increase synaptic. Okay.
Reuptake is not taking place. Now we are talking about the concentration in the synaptic space, right?
Okay.
Because if you have more, action will be more, na? There, right? So norepinephrine concentration increase, na?
Increase.
CNS stimulation,
Stimulation.
hypertension, right? Okay. Blocks norepinephrine release, blocks the release. Norepinephrine concentration increase or decrease? Decrease, na? It is not released, na? From the neuron.
Yes, decrease.
Decrease. So BP?
Decrease.
Decrease. Right. Examples are guanethidine, beryllium. They cause what? Decrease in BP. They are antihypertensives. Clear?
Yes.
Okay. Then you have, we said MAO, right? Monoamine oxidase. Thing is, we have two different types of MAO. Okay. Monoamine oxidase A and B. MAO A and MAO B. Okay. MAO A metabolizes your noradrenaline, right? And serotonin.
And serotonin, yes.
Okay, which two? Noradrenaline and serotonin. Okay. MAO B metabolizes your dopamine and
tyramine.
Okay, tyramine. So MAO A inhibits or metabolizes, not inhibits, metabolizes noradrenaline and serotonin. Okay, serotonin. MAO B metabolizes dopamine and tyramine, right? So if I go and inhibit MAO A, I will be increasing the concentration of norepinephrine.
Yes.
Yes. So MAO A inhibitors, they potentiate norepinephrine.
Yes.
Yes. If I go and block MAO B, this thing, block it. I'm increasing the concentration of what? Dopamine.
Dopamine, yes.
Okay, Parkinsonism, remember? MAO B inhibitors.
Yes.
Sedgilin, rasagilin. Right? So potentiate what? Dopamine. Yeah. MAO B, when they are blocked, what is inhibited? Sorry, whose metabolism is inhibited? Dopamines. Okay, MAO B, dopamine. Clear? So, dopamine's concentration increases. Clear?
Yes.
Okay. Now, what about
concentration increases or decreases?
MAO B को अगर inhibit करोगे तो dopamine metabolize नहीं होगा ना?
Yes.
नहीं होगा.
हाँ, तो concentration increase होगा ना?
पार्किंसोनिज्म में यूज करते हैं उसको.
हाँ. Concentration increase नहीं होगा dopamine का? What is your doubt, Sabreen?
वही नहीं समझ में आ रहा है.
क्या नहीं आ रहा समझ में? नहीं, कैसे होगा ये नहीं समझ में आ रहा है कि डोपामिन अगर बढ़ा तो कैसे यूज करेंगे पार्किंसोनिज्म में, ये नहीं समझ में आ रहा.
हाँ, इंक्रीज कैसे हो रहा है?
इंक्रीज कैसे हो रहा है? क्योंकि मेटाबोलाइज हो रहा था पहले, अब नहीं हो रहा है.
हाँ.
Mao B
Okay.
was active, na? Mao B was active, na? So it was
Huh.
metabolizing dopamine, na? The concentration was what? Suppose baseline concentration. Now, if you go and block Mao B, concentration has to increase, na? Because now it is not getting metabolized normally.
Okay.
Yeah.
Huh.
Clear?
Metabolize.
Metabolism. Clear, na?
Yes.
Okay, right. Something clear?
Huh.
Okay, take it. Right. Okay. Now, COMT, what it does? Catechol or methyl transferase, again, metabolizes your norepinephrine.
Yes.
Yes, if you block it, concentration increase, na?
Increases.
Okay, right. So, why we took this? It is not to learn. You don't have to learn the names and all. You have to understand what happens when these things happen. Understood? Concept clearance is the major, what? Major goal. Okay, goal here, right? So, by explaining this chart, right? So these drugs we are going to learn in different chapters. Don't worry. When we take up what Parkinsonism, you will learn about MAO-B, right? When we take up hypertension, you will again learn about what methyl dopa. Understood? Amphetamines and all we will take up in this chapter only, right? So these things we are going to learn only, but you have to understand the concept why this is happening. Okay, that you understood, na?
Yes.
Okay, right. So we will take up the drugs on Monday, right? If you have any doubt, you can ask. Just a second.